Hi everyone, it's Ginger again. It's only been about, maybe 17 months since I posted last. Last time I left you guys, I was laying in bed in a lot of pain. If you hadn't noticed, I got some fancy new glasses. They sparkle in the sunshine. It makes me very happy. Back on track. I was in a lot of pain. I had some lumps in my butt and went to the ER. Actually went to the urgent care. Didn't really know what to do. Went to the ER, and ER got me taken care of. Got me back with my, I don't know if I updated. It's been a while, so I'll update on that first. Got me some pain medication on board, which didn't really help. But spoke to my clinic in Pasadena, and my clinic was hesitant to take me off of the injectable PIO, or PIO, progesterone shots, even though I had complained at transfer and I'd complained the day before. They were very hesitant to take me off, but my ER doc basically said, look, I can't touch her butt cheeks. The patient told me, and I did tell her, cut them off because it would hurt less. So they took me off of the injectable progesterone and gave me lozenges, which tasted like crap, but worked a lot better as far as pain went. I am figuring out my new phone. Sorry. I did all right with it after that. We, waited. I was 5 days post-transfer when I went to the ER. My HCG was 0 at that point. I didn't know that until later. We did our 14-day wait, which was horrible. I started taking home pregnancy tests maybe a day or two after my ER visit. Was getting negatives. Told myself after the second negative I was just gonna wait, not gonna keep doing it. Instead, of course, because we're all very anxious, I went to the store and bought more and kept getting negatives, and after probably the 5th negative I was like, that's it, I'm gonna wait. So I waited. So we did an HCG on the 13th, 14th day, right around there, and my level was 7. So my clinic told me that it looks like it implanted and then stopped growing for whatever reason. We were gonna continue meds at the moment and retest in 3 days, which we did. She said basically at that point the goal was to make sure that the levels kept going down and not up, because if they kept going up it might mean that there's something else going on, possibly an ectopic, which was their main concern. So 2-3 days later, whatever it was, my level was at 38, and 3 days after that my level was at like 83, and 3 days later it was at 181, and it just kept going up for about a week and a half. I am a labor nurse. I have some knowledge in pregnancy issues. Glitch in the system. Hub's called. Had to answer it. He said Armageddon is coming outside. We have a storm rolling in. So anyhow, it kept going up, and as I said, I am a labor nurse. I have a plethora of obstetricians around me on a regular basis, many of which deal with IVF patients and surrogates. So naturally I ran it by one of my docs. Here's my situation, here's what's going on, here's their fears, how valid are these fears, and how worried about this should I be. Basically my one doc, who is I've asked to be my backup obstetrician at work if my physician is not available, or if I have to deliver at the facility I work at, not the facility I've chosen, it said that it sounds more than likely that it is just a poor quality embryo that wouldn't last anyway, and I will most likely miscarry. He's ran through a quick assessment. He said you have absolutely no risk factors for a tubal or an ectopic pregnancy, and that with IVF patients it's more unlikely because the embryo is placed directly into the uterus and it doesn't pass through the tube at all. He said more than likely, if anything, you're just going to miscarry it anyhow. So we did a couple more beta HCGs and did an ultrasound at the 6-week mark. So I was testing positive at home at that point because, I wanted to test just for kicks and giggles. At 15 days, I finally got a positive on a home pregnancy test, and the parents were aware. I had not spoken to the parents. I should tell you, I have not spoken to the parents of the potential baby that I will be carrying. They've chosen to remain anonymous at this point for the pure simple fact that they have had many, many, many losses and many disappointments, and they have done at least one round with a surrogate already. I am their second surrogate, and at risk of their emotional health, they chose to not create a bond with the surrogate myself until we were sure that this was going to stick and everything was good. So I was aware of that going into it. Please no blasting. Please no, oh my gosh, how would you do that? You don't know anything about them. Know that my parents have been amazing, and every correction or issue I've had, our go-between has told me nothing but positive things, and they have been completely accommodating to everything from my home life and my work schedule. I am completely okay with this. I knew this going into this contract and this arrangement, so please don't blast me. I don't want to hear it. So back to baby. So 6-week mark hit, and I went and got an ultrasound. They determined at that point that there was no fetal tube, I believe they called it. Basically, it was an empty sac. It had implanted, and everything had grown but the fetus. So I, of course, did my own research and looked into it. It's called a blighted ovum. I'm sure some of you have possibly heard it or experienced it yourself. It is basically when the mother's body realizes that there is something wrong and blocks progression. However, all of the supporting tissue still adheres and still grows as normal. Just the fetus or the baby is what is blocked, which in my case is exactly what happened. I was given at that point a choice of doing a DNC or allowing my body to pass it naturally. I am a little bit more granola in my way of thought, so I chose the latter. I spoke with my physician and my regular physician, not my IVF physician. And I spoke to a friend who's had many, many losses and gone through DNCs herself, and spoke to some other friends at work and got their opinions, and spoke to my husband, and we all kind of just agreed I would rather not be put under to go through an invasive procedure if not necessary. There's some very real risks to DNC, and they just didn't sit well with me, so I thought better not. I did end up passing it. If you do not want to hear details, shut the camera off now or shut the screen off now. I'm not going to get gory, but for those of you that are experiencing a miscarriage, because essentially that's what this is, expect heavier bleeding. Mine was much more heavier than I anticipated. I assumed because I was so early on that there wasn't much clotting. I did not have much of that, but I assumed that later in pregnancy, or at least later in the first trimester, you would have more clotting as the tissue passes. It did make me slightly cranky. I had only just, I think the hardest part for me was I had, in the maybe 3 or 4 days before, started to have those obscure early pregnancy symptoms, nauseated for kind of no reason. I was getting kind of tired. We went out to breakfast one morning and my husband ate some sunny side up eggs, and it makes me nauseous thinking about it. The eggs on his plate, like the way they moved, was making me sick to my stomach. But I got it out. I was cleared in January. It is September 10th today. I was cleared in July, around the end of July. That everything was clear. My beta levels were back to 0. My uterus was clear. Everything had been expelled. There's nothing growing in there. And as of right now, I have been back and forth with my clinic. It was my understanding that my parents did want to try again, but however, that was their last embryo. They are overseas, so the logistics of getting them over here and getting more embryos made was quite a daunting task. And clinic said it's going to be a couple months. I assumed at the time that it would be around September, October. now I'm thinking probably not till end of year. As I spoke with my agency, Danielle at Central Coast Surrogacy in California, shout out to Danielle because she's pretty amazing. I just found out that we will be using egg donor this time around, so we are waiting for an egg donor to contract and cycle with my parents. And at that point, then we'll do this all over again, and I will keep you guys updated. In the meantime, I do have a friend who is just beginning, and I'm very excited. Even though this is my first try, I did learn a few tricks this first transfer. I'm very excited to be helping her and kind of being like just moral support for her in her first go-round as well. So hopefully I'll have something more for you here pretty soon. If you guys have any questions or comments or anything that is not negative, by all means stick it right down there in the comments, and hopefully I'll be seeing you guys sooner than later. Bye guys.